Your child isn't eating normal. We want to check in with Dr. Julie. She's talking about something that's a fairly new disorder, and why we bring this up, because most people, it's often easily missed, even by doctors.
Absolutely. So Avoidant Restrictive Food Intake Disorder is a new diagnosis that came out in 2013.
Okay.
And its symptoms can look like anorexia, but the origins have nothing to do with weight or body image.
Interesting. And it can also sort of be missed as maybe I just have a picky eater.
Absolutely. So the signs are going to be a child that wants to avoid eating, but it is not because of caloric content.
Okay.
It is because of primarily sensory sensitivity, so aversions to certain textures, colors. The meat's rubbery, Mom. It feels slimy. Also fear or anxiety of aversive consequences of eating, like choking or vomiting.
Wow, okay.
Yeah. And lastly, the last category is just a disinterest in food.
Okay.
Okay, but again, not because of calories, just because primarily of genetics, believe it or not.
Especially at a younger age, you know, they have no idea what even calories are, right? When could we possibly start, at what age are you seeing this happening?
So we can see this in toddlers.
Really?
And it is oftentimes missed, not only by family members, but by physicians. And they show up as an adult that has struggled with this for years, never understanding what it's about. It's very common to find that in our eating disorder world.
Now, many of the symptoms you described, I think a lot of parents would see it as, oh, they're just a picky eater. They don't like this texture. They don't like this flavor.
Absolutely.
You know, it's normal. When should parents be concerned and talk to their doctor about it?
Absolutely. So picky eaters are going to have certain foods that they don't like, but not so much categories of food.
Okay.
So if your child's talking about yucky textures or almost kind of chokes and feels nauseous at maybe the smell of eggs or broccoli, then you want to start paying attention.
That's not normal.
That is not normal. Picky eating also, believe it or not, doesn't affect weight, but ARFID shows up as low weight or a failure to meet expected weight gain in children. That's very, very important.
So being underweight is a big factor.
Being underweight. And then in adults, it could be fatigue. It can be nutritional problems because they're not eating a full spectrum of food.
Is there a fix to this?
So absolutely, but the diagnosis is imperative, because if you treat a classic eating disorder, you're going to miss how to really treat ARFID.
Okay.
So it can be a combination of cognitive behavioral therapies, gentle exposure therapy, and then some medications to help with the underlying anxiety that oftentimes goes with ARFID.
Wow, I think we've opened a lot of eyes, because I think a lot of people out there goes, I've never heard of it. So thank you so much for bringing it to our attention and wanting to talk about this to share with our viewers. So important.
Always my pleasure to bring this information.
Thank you, Dr. Julie.
Thank you.